Real Transection in FUE, Hidden Transection in Donor Site by Dr. Dae-Young Kim. The object is to know what happened during FUE harvesting in the donor site. It is generally accepted that we estimate the transection rate based on only extracted follicles. Is this really the most accurate way? For a truly accurate TR definition, we must account for the hidden transection rate. 2 to 4 study boxes were drawn on the donor strip sites of 12 FUT patients. The study box was 1 centimeter by 1 centimeter, and its horizontal width was divided at an interval of 0.25 centimeters, marked by 3 vertical lines, A, B, and C. A total of 8 FUE punches, 4 each along lines A and C, were made. We used a motorized and oscillating FUE device with a 1 millimeter sharp cannula punch. Here we can see the 4 FUE study boxes marked on the FUT donor strip. Here are the 32 follicles obtained from the 4 study boxes. A 20-power digital video microscope was used to analyze the transection of the harvested follicles from each study box. The red arrows indicate the 4 study boxes on the donor strip. Each study box was slivered along the FUE punch line under the 20-power microscope. The scalp tissue of the study box was slivered along the FUE punch line under a 20-power microscope. The holes, which are arranged vertically in line, are FUE punch sites. Having both a skilled technician and a 20-power microscope reduced the transections during slivering. This picture shows the sections of slivers along the punch sites. 4 punch sites are observed with ease on each section. 2 slivers along the FUE sites were analyzed under a 20-power digital video microscope. The blue dye indicates the extraction sites. We examined the transections in the donor site after using the FUE punch and observed partial and total transections around the punch sites. When we look under the surface, we find various hidden transection sites. Here, one transection site is hidden under the scalp surface, keeping the shaft alignment. We name this hidden transection. Here we see a hidden transection caused by punch number 2. We see a hidden transection. A partial transection has the transected lower part of the hair left in the sliver, and its upper part can be seen in the extracted follicle. The transection in the red circle was a slivering injury made by a technician. We can assume this because it was not near punch sites 2 or 3. To differentiate the slivering injury by technicians from hidden transection, the whole process of slivering was videotaped and reviewed. There were a total of 12 patients. Harvesting was performed by an FUE expert for 6 patients and by an FUE beginner for the remaining 6. While they harvested similar levels of total TR, there was variation in the level of harvested hidden TR, 3.6% for experts and 10% for beginners. More hidden TR was noted when done by a beginner. 88% of transections by a punch were from the upper side. The depths of hidden transection ranged from 1.7 to 4 millimeters. Average depth was 2.9 millimeters. On the basis of the results, we tried to find out the causes of hidden transection. The first possible cause is that hidden transection is made by excessive pressure on the skin during punch insertion. This is due to unskilled technique, use of a dull punch, or the hard skin of the patient. Secondly, of hidden transection can be caused by extraction with extremely deep insertion of a punch. This can often occur among Asians with long follicles. To prevent hidden transections, it is necessary to use a tumescent solution to give full expansion of the donor site and reduce fluid dynamics of the scalp skin. It is desirable to use a sharp punch rather than a dull one to decrease pressure on the skin. It is also desirable not to insert an FUE punch too deeply. These methods were first suggested by Cole. Here is the correct way to calculate real transection rate. This study has 3 limitations. It is a small-scale study with 12 participants and a high transection rate. Further research is needed to determine how hidden transection affects hair regrowth. Thank you.